All right, we're Questy. Hi, he's back. Let me know if there's an echo. I am outside as I'd like to try to be as long as possible, as Vermont allows. And sometimes if there's too much noise in the background, there's an echo in the noise canceling. So again, welcome to the September 18th Gravity Public Call. We're going to be continuing our discussions on community level domains of food access, neighborhood safety, and access to green space. I am Sarah DeSilvi, Director of Terminology and a Gravity co-founder, and we're really glad you're here. Next slide. Thanks for joining. Everyone's muted upon entry, but we do talk a lot. It's like more of a seminar format than anything else. We want to make sure your questions are answered, and this is a consensus space. All calls are recorded. They're available for posterity on the Confluence after the call. We do use the chat a lot, and everyone's encouraged to participate in the chat, but please send chats to everybody just so that we can not leave folks out and just so I don't accidentally read something out loud I'm not supposed to. Next slide. We, as a HL7 accelerator, this is Gravity is an HL7 accelerator. We are required to follow American National Standards Institute accreditation standards, which includes abiding by antitrust practices. We do apply these recommendations quite generously, so it's not even just direct violations, but trying to avoid any behavior that might be construed as an antitrust violation. Again, it's all part of ANSI guiding principles for crafting open consensus data standards. Next slide. It is so beautiful here too, which is why I'm out on my porch. All right, so our agenda, brief welcome and announcements. We'll do our high-level fall 2025 concepts, topics and goals just to orient us. We'll then go into neighborhood safety concepts. We have a guest speaker from Prevention Institute today, presenting on a framework that we are using in our work with neighborhood safety. We'll then address food access concepts, then access to green space concepts, those cross-domain updates one more time that we had last time, and then close with the community homework and next steps. Next slide. Next slide. We always try to cover the 3 work streams. So here we are in terminology and tech. We're continuing to work through the use cases from our update to the next iteration of our implementation guide. The meetings are Wednesdays from 1 to 2 Eastern Standard Time. All access to any meeting can be found on the Confluence, and Sarah Bahal just put it in the chat because she's amazing. Implementation work stream, we are meeting quarterly. Our next meeting is November 20th. We've been focusing on topics in implementation that leverage Gravity terminology or exchange standards for return on investment use cases. We'll do the same in November. This is not upcoming, but it just happened. I just mentioned it. It is still happening, but we are not there anymore, Gravity. The 39th annual working group meeting in Pittsburgh, the HL7 working group meeting. It was a really great meeting. If you can imagine what we do here within our terminology work stream and what we do collectively within our Gravity community, at the HL7 working group meeting, we all meet, all of the accelerators, all of the working groups, and we all do cross-collaborative presentations and analyses to make sure that we're working in kind, and really to make sure that we're sharing learnings and findings and resources from a use case that might not be social care specific, but can be helpful in meeting our goals. Jennifer, thank you for unpacking your acronym. Anyway, working group meeting was a success. We'll talk more about it, and the materials from working group meeting will be available on the Confluence, but that's why my voice is gone, because so much talking and collaborating, and then just being with people who are brilliant and I've known for some time. Our next formal presentation is the Civitas Annual Conference, September 28th to 30th. We do have a Gravity presentation there, a panel there. It's all about our enhancement work that we did, the member-led enhancement work. If anyone's going to be at Open Epic, though, I'll be there before I go out to California next week. speaking again about gravity and our processes there. So we'll hope to see you in all the places. Next slide. Any questions on the announcements so far? We do have a guest speaker, and I want to make sure I get to them as soon as we possibly can. So I think we're doing good on time. Next slide. If for the sake of time, so Gravity Project, I'm going to try to just buzz through some of these things. We are representatives of a sustainable consensus community that's collectively driving social care data standards to support the goals of population health and health equity. Next slide. We wouldn't be able to do what we do with our members. I saw so many members in real life this week. It was so lovely to connect with friends across the lovely. Thank you, Rachel. Um, uh, uh, with friends across the ecosystem. We'll let Lisa in. And we are unique in the fact, and this is very unique across HL7, that we do have that designated membership model. Most accelerators are purely sponsor member driven, but we do have the designated membership to ensure that we have community-based organizations and patient-centered in all of our governance work, grounded in our social justice principles. Next slide. And this is our roadmap. No changes here. Again, trying to move a little quicker in the intro stuff to get to our presentation, our guest speaker, because she has a time frame. Next slide. And then closing, we'd be remiss. We always center our data principles when we do our work. These are improving personal health outcomes, improving population health equity, ensuring personal control, designing appropriate solutions, ensuring accountability, and preventing, reducing, and remediating harm. We are working with our members, and Lucy, I'm going to tap you for the next operating committee to talk about analyzing them for appropriateness. We always should go through our principles and see if they need updating, given that the system and the ecosystem is evolving, and we want to make sure our principles align with this moment in time. Next slide. Okay, I'm trying to get any questions on the really brief overview of Gravity and what we do. All right, next slide. I think I can quickly, Asha, go through the topics and goals to get to our guest speaker in time for her. Do we have Lisa in the room now? Sarah B, is Lisa with us in the meeting?
Yeah, I believe so.
Wonderful. Thank you. I just want to verify. I couldn't see her. So I'm just going to quickly do the topics. If we just go back a couple of steps. Yeah, so this is the general slide we're using for our orientation. Welcome, Lisa. So good to have you. On how we got to community level concepts from household and person level domains. We've been planning for this a very, very long time. And we know, I mean, we work in, healthcare in 2025. We know from whether it be community health needs assessments or goals of population health or public health, you can't solve it by addressing person level and household interventions only. You need to think big picture. So we've been planning for community level concepts for some time. This is very much grounded in our conceptual framework that grounds our work, which is the World Health Organization conceptual framework for action on the social determinants of health. And it's an honor to address these domains in our work this season. And next slide. And now we're just going to go directly to I'm going to cover this every single time. So I'm going to skip it now, only to center our one amazing SME who's here and respect her time. Next slide. It is my honor to welcome yet another expert from the Prevention Institute. We've been honored to have guest speakers from Prevention Institute a couple times over the course of our work so far, and Lisa Parks is here to present on a framework that we've been using and leveraging in our discussions with our neighborhood and community safety subject matter experts. Lisa, welcome, welcome. Ash, anything else to say, dear friend?
No, I think that's it. I just want to make sure Lisa can share her screen so that she can advance the slides. You're on mute, Lisa.
Okay, can you hear me now?
You
Yeah.
can, yes.
Okay, great. Hi, everyone. It's a pleasure to be here. I've heard such great things about this project. I'm really uplifted by the work that you're doing. So thank you for all that you do. And thanks for the opportunity to share some of our work here at Prevention Institute in partnership with the Big Cities Health Coalition. I'm going to go ahead and share my screen and start the slideshow. So, and Sarah and Asha, you'll help me keep time.
Absolutely. We'll give you a little time signal. But
Okay.
you have until 4:30
Okay, great.
EST, correct? You have like,
Okay.
is that when you have to leave, correct?
Yeah, whenever. Yeah, that sounds about right. Yeah.
Okay, fantastic. Yes, we'll help you. Thank you so much.
Yeah. Okay, great. And I do have opportunities for participation through using your chat function. I always think, we learn more when we are actively engaged. So I don't think I can actually see the chat while I'm presenting, at least on my laptop. So please feel free to use the chat nevertheless. And Sarah and Asha, if anything comes up that you want to share, please just go ahead and insert and share what's
Sure
coming up.
will. Sure will, Lisa.
Okay, great. Okay, great. So yeah, so Sarah mentioned this framework that you have already been exposed to, or some of you have already been exposed to, and I'm happy to share it with this group. The framework is called Community Safety Realized: Public Health Pathways to Preventing Violence, and Prevention Institute developed it with the Big Cities Health Coalition. As we get started, I invite you all to think about your own community and what in your community or who in your community helps you to feel safe. And feel free to put that in the comments. I think, when we're thinking about issues that affect our own lives and our community's lives, it's helpful to reflect on our own lived experience a little bit. So feel free to put that in there. To get us started on what is neighborhood safety and what really truly helps us to realize and achieve community safety. So here's the framework, and I'm sure we can share the link to download it if you're interested. We developed it with Big Cities Health Coalition, which is a forum of 30 or more at this point local health jurisdictions that are working together to promote policies and practices that build healthy and safe and resilient communities. So for these local health jurisdictions, violence prevention had been a priority. And we partnered with the Big Cities Health Coalition to develop this framework for two reasons. One was to help grow collective understanding of community violence prevention and community safety work and the role of public health, and also to invite collaboration among multiple sectors who need to be engaged to play a role in preventing violence and building community safety. So if you don't know, Prevention Institute, we're a national nonprofit. We promote health, safety, and well-being through thriving, equitable communities. And since 2005, over 20 years now, we have been partnering with many large cities, some counties, some states, and working nationally to develop strategies and plans to prevent violence, and really to define, advance, and evolve and grow a public health approach to community safety. And I've been partnering with Rachel Davis, who's part of this collective effort for many years now on this. So that's where we're coming from in terms of how we came up with this framework and why we created it. So core to this framework is what we call the pathway to violence, or the pathway to safety. And it's really a tool to help explain and visualize the range of drivers and systems and factors that influence the likelihood of violence in our community, or the likelihood that safety and healing will be achieved. It helps to take issues around safety and violence, and that can be very complex, and describe the relationships and opportunities for involvement and intervention. So here is the squiggly pathway. In gray is the pathway to violence. And in green is the pathway to safety. And we're going to talk about both of those. I'm going to start on the left-hand side, which is start here with the red arrow, and explain the relationship between things, what's happening at the broadest social level and how that impacts individuals. So we're going to start with naming at the broadest social and structural level the role of social and racial inequality, inequity in this country. So along with legacies of systems for justice and equality, we have legacies of structural racism and other forms of systemic inequities that are baked into the country's founding and are still evident today. Given that, following the Gray Pathway, the next is inequitable systems and institutions. When you have at the broadest structural level inequity baked in, the result is that is reflected in our institutions and systems. And so one example of that is redlining and inequitable government investment in racially and economically segregated neighborhoods. So I imagine that many of you are familiar with redlining. It's a reflection of inequitable institutions and systems, and created drastic inequality and racial and economic segregation in communities throughout our country, in cities and throughout our country. So you can see here this flow from social and racial inequity at the broadest systems to how that is reflected in equitable institutions and systems. And when you have inequitable institutions and systems and practices like redlining and inequitable, there we go. When you have inequitable practices and inequitable investment in neighborhoods, the result is for communities that are on the receiving end of that inequitable disinvestment, you have conditions like concentrated disadvantage and underfunded schools. And if you are living in a neighborhood that is experiencing concentrated disadvantage and underfunded schools, you are more likely to experience economic stress, low educational achievement, and other known risk factors that increase the likelihood of violence. And if that is the case for those community members, that leads to a greater likelihood that there will be higher rates of community violence and racial and other inequities in rates of violence and resulting injury, trauma, and death. So that is the pathway, that is the unfortunate pathway to violence that helps, again, to show the relationships between the broadest social and structural foundations of our country and how that shapes institutions, community conditions, the experiences of individuals and families, and the resulting outcomes for those individuals and families and those inequities in those outcomes. So that is the Gray Pathway to Violence. So let's talk now about, so here's another opportunity to comment in the chat if you're interested. And actually I can see the chat. So let me just take a look to see if anything's coming up. And feel free to also put in the chat some of the factors in your community along the pathway to violence that stand out to you, that increase the likelihood of violence, either in the neighborhood where you live or in neighborhoods in your city or community. Okay. There's the
I actually
framework.
put one.
Yeah.
I put one in there. I'm Janice. I live near the first mixed
Janice.
HUD housing. Yeah, Yesler in 1947, I believe it was built, and it's been rebuilt. And previously there was a number of refugees and immigrants and others who also lived there. 516 housing established, units, and they have replaced them, but they're more with high rises, and people lost their little plots surrounding them, but they still have a big community garden but in the area, it's been very gentrified, you know, over years. And so, and still is, right? And just the fact that those were 1947 and had to be rebuilt to me seems, you know, sad. It was really about having more mixed housing and more income taxes coming in.
Thank you for that example, Janice. Yeah, in your example, you're naming a number of different kind of interrelated factors. And I'm also glad that you named gentrification because in working on community safety, it's something that communities need to pay attention to, that as conditions improve, the sort of gentrification pressures can increase as well. So paying attention to that is important to ensure that the people who are most affected by violence aren't displaced into another neighborhood.
Yeah,
that
they
is
were for a
experiencing
short time
distress.
in this case, but some of them were while
Yeah.
we were building. But another thing is this, when that was built, redlining was still in here, you know, people couldn't get, they weren't able to get loans, people of color, pretty much. And so Jimi Hendrix grew up there too, by the way.
Wow. Well, thank you for that example and making this very real and concrete for folks through that example that you're offering. Let's talk about the pathway to safety, which is the green pathway. And again, we're going to start on the left-hand side. So this is going to really highlight how we can change the pathway to violence, right? We can influence the conditions along the pathway and change the results. We absolutely have the power to increase the likelihood of our communities being on this pathway to safety. And at the largest level, that really does involve dismantling the legacies of structural racism and building health equity and racial justice, so that our institutions are just and our systems are just, for example, as reflected in equitable investment by financial institutions and government in neighborhoods with anti-displacement protections. That would make such a difference on health outcomes and safety outcomes throughout our country and our communities. And when there is equitable investment, there is a greater likelihood that people will, in an equitable way, experience economic opportunity, stability within the community, stability, housing stability. There'll be greater government community trust at the neighborhood level. And when we have neighborhoods that reflect these kinds of conditions, the people living in those neighborhoods will experience greater economic security, increased social capital, all of those individual and family level factors that are associated with decreased likelihood of violence, increased safety and healing, and decrease inequities in injury, trauma, and death. So many opportunities to have change along this pathway, and many different roles of community organizations, government, other sectors, and other institutions to increase this pathway to safety. So feel free, as you're thinking about this, to continue to put in the chat what are some of the community assets in the community or actions that are being taken along the pathway to safety that are helping to keep people, individuals, families, and communities safe. Would love to hear those examples as well. And this is the full framework. It's a 2-page full out. I've seen poster size examples of this in offices as well. This complex framework takes that pathway to violence and pathway to safety and shows kind of a menu of different types of interventions along the pathway in green. So these are things that are associated with increased likelihood of increasing safety and decreasing violence. And below that, you will see the kinds of partners, the kinds of sectors and systems that would play a role in enacting those interventions. So you know, you have everything from, at the broadest level, things like voting enfranchisement and decriminalizing substance misuse, mental illness, and poverty, you know, at the broadest level, you know, down to community level interventions like access to safe parks and green spaces and affordable housing and early childhood education and family supports, as well as interventions more at the individual level where you might have peacemaker fellowships or gun safety practices, as well as interventions that help people to heal from trauma and decrease the likelihood of involvement in violence in the future. So that is our community safety realized framework, presented extremely quickly. Here are some slides that show some of these examples along the pathway of different types of interventions. And I don't have time to go through them, but I encourage you to take a look at the framework. And there's another component to the framework that talks about what we call the four core components of a public health approach. And I have a few slides in here that describe what these four components are and give examples of local action. I think we'll probably share these slides, so they're there for you to access. I think it's helpful to see examples from different communities and how they've implemented these types of principles and practices. So yeah, I'll go through just a couple examples in the time that I have. So one of the principles really is around truth, racial healing, and transformation, which is really naming and building shared understanding that violence is rooted in structural racism and other forms of oppression, and building the public will for equitable policies and systems. And in Santa Clara County, the Public Health Department participates in the Government Alliance on Race Equity trainings and organizes local activities for the National Day of Racial Healing. Another component is supporting community leadership and power. So that's about increasing the leadership. I see Lucy. Yeah, let's take Lucy's comment. I'll stop here. Would love to hear your comment, Lucy.
Yes, thank you, Lisa. I want to build on what Jonathan wrote in chat and what I wrote, namely the role of local CBOs in articulating and practicing and representing models of community tolerance and responsibility for others. And I didn't see that anywhere in your massive chart. So I just am hoping that perhaps as a result of this conversation, you might consider adding it. Thank you.
Yeah, thank you for naming that. Yes, I hope that's been noted, or I'm not seeing it in the chat, but I appreciate your comment.
I meant I didn't see it in your chart. It's your chart is quite elaborate, but I tried to skim it and I didn't see that. Perhaps because you work so much with local government rather than with local CBOs. So just think about adding that as an element. Thank you.
Yeah, that is a really good point. I appreciate that and completely agree with you. And somewhere in here, I mean, there is a lot there's under these core elements, resident leadership, community-driven solutions, kind of in there in this blue band, but I really appreciate you naming CBOs specifically as critical to resident leadership and community-driven solutions and government community trust and so on. So thank you very much for bringing that up. I believe that my time is up. Yeah, Sarah and Asha, is there anything else that I can share or respond to be helpful to the ongoing work that you all are doing?
So I have there's one question I would love to. First of all, lovely, gorgeous framework. I thought, just for the sake, because I know it's hard. I think community-based organizations are called out specifically in I forget, it's on the 2/3 on the bottom. Yes. Yes, I don't remember the throughput, but I know that they're there on the bottom as well. They're on the top in the blue band, but they're also there as a direct
Okay.
collaborative entity and organization on the bottom. I just want to call that in.
Thank you.
It is a very challenging framework to capture in this brief amount of time. Can you, but we did send it in advance and we put it in links and we'll have it available for some time to digest and the report is gorgeous that accompanies it. I have one question that a member said that was so salient and you can see my enthusiasm in the chat relating to gentrification, right? So you saw the question, I was calling into light that anti-displacement efforts. And then you see Jill Rushton Miller saying, how do we prevent the processes here leading to gentrification, the displacement of the people whose interventions were meant there to support? We talked pretty much significant, like almost entirely in our SME meeting about that today. And I'd love to have your insight. Thank you.
Oh.
I know, or maybe come back. I don't want to
Yes.
put you on the spot, but yeah.
Yeah. I think, well, I'm glad that you all are addressing it.
Yeah.
And as you could see, it was important for for me to mention and for us to call out in this framework as well. And as different municipalities have worked with their community partners to develop violence prevention plans, we really strongly encourage that they include anti-displacement components. Different locales have approached that differently, with mixed degree of success. One of the wins, I will say, recently that we are applauding is in Santa Clara County, where the East San Jose Peace Partnership was able to influence the city of San Jose's housing elements to put in provisions that for affordable housing that is developed in the neighborhoods, the zip codes that are experiencing presently the highest rates of violence, that as affordable housing is developed, the existing residents would get priority for moving into that housing, which is not always the case.
Yeah.
And so that is just one example. I'm trying to think of other examples. Yeah, nothing is top of mind. We do have another report on anti-displacement strategies, so maybe we could share that as well. And
I think-
perhaps there are others in this group who have some examples in mind. Oh yeah, so Rachel put in the chat.
I know, she's got your-
2015. Yeah.
Thank you so
And
much.
yeah. Great. Well, thank you for the chance to pop in here. I wish I could stay, but I need to go to another meeting, and I know you all have important work to do. But we're here, and I'm glad that Rachel's continuing to be involved in the process, and wishing you all the best of luck, and happy to be in conversation again in the future.
Thank you so much for your time and expertise and the beautiful framework. And friends on the call, we're going to continue to revisit it over the course of the next weeks and months. So incredibly grateful, Lisa. Thank you.
Okay, thank you. Bye-bye.
All right. Okay, so as Asha's pulling back in, I just want to note, Rachel, you're so good at that. Finding the Prevention Institute paper that points exactly to the topic at hand. So Asha, it looks like we're in presenter view as opposed to, I know it's hard with the screen. There we go. Okay.
Thanks.
Yes. Okay, so we're you're welcome. So now we're gonna go again, such a powerful framework. We are digging our teeth into it in our subject matter expert meetings. I just want to say the questions that happen, I think you saw my enthusiasm. Lisa was on a timeline, so we had to let her go. But the questions you all were raising today were the exact questions that we were raising, that our SMEs were raising during the meeting today, which is ensuring that we like housing structural improvements don't displace the communities of intent, right? And so very apropos, and again, finger on the pulse of the conversation. So now we're going to go into the rest of our presentation. Again, very grateful. Next slide. So we, and again, we have SMEs on the call. Should I say anything that seems incorrect or could be phrased better, please let me know. And everyone on the call, just as we all do this work, it's a consensus process. So we always try to come back next time with better framing and better wording than we had the week before. So I see a question from Lucy. Oh, so Lucy, we're going to actually talk about this very, very shortly. And so we're talking about if we're going to be, if we're following our SME's advice, it actually is creating like a very trim, narrow, focused, evidence-based list of social risk statements, but a very strong and long and strong evidence-based list of goals, right? And all of those goals would be kind of the benchmark for that moving towards safety plan as opposed to moving towards communities of violence. This is all going to be unpacked at the next couple slides. So the three base metrics that our SMEs have elevated so far really came out of that work that Lisa and the Prevention Institute were speaking to. We have these three base concepts we presented. Two of them we presented last time: perceived safety and trust in law enforcement. We're also sorry, if we go back one slide. Oh,
Uh-oh.
that was the whole presentation. We'll get back. Oh, Jill, that's a nice that's a good idea. Okay, we're back. And so one of the things that Jill is actually Dr. Russian-Miller, I'm going to call you Dr. Russian-Miller until I'm told not to, is highlighting is the relationship. Okay, great. Is the relationship between concepts and measurement, right? Sometimes instruments come first and then concepts come, and sometimes the concepts are salient and we think about how to measure them, right? With instruments. So that's very apropos. So our three core concepts that we have at this time are perceived safety, trust in law enforcement. Those were there last week. But we're also leaning in to one of the three metrics from this collaborative work, national consensus work that predates us, was identified non-fatal injury rates. And what we're actually, the only remaining thing there is trying to figure out where the data comes from. Because unlike some of our other domains, the CDC level data is not, it isn't represented at census tract or community level data that's actionable for the communities of reference. But of course, hospitals, emergency rooms, entities that are local in communities have this data as well. And so this is a work in progress as we think about where the actual data comes from. But we know clinical systems absolutely have the discharge diagnoses from emergency rooms that drives the national CDC rate. So that's fun collaboration with public health departments and hospital systems as we think toward that one. Next slide. However, and again, SMEs, call me in. I can't do a better job than Lisa just did, but you can see why we are based on the presentation of the framework. We have those three concepts, but we are deeply focusing on those factors that move you along the green path, right? So if we know what works, what gets to communities to address structural forces, do all of the work that's required to aim towards safety as an outcome, we're going to be building those concepts as a priority. And you'll see that over the course of the next, you saw that in the presentation, and you're going to be seeing it emerge in the concepts coming from the subject matter experts. And so what we are doing is developing this comprehensive list of goal list grounded in strengths-based perspective so we can design interventions that take us through toward safe communities. You're going to see a lot of concepts that are pulled forward from the work that we did in developing protective factor languages and very similar models and themes that we had from our protective factors work, because it's a strengths-based perspective. Next slide here. So this is a little bit flipped because we presented the Prevention Institute framework first because of Lisa's time constraints. So that is one of the core frameworks that we're using because it is all strengths-based in its orientation. And if anybody on the call who's a SME wants to say anything more, please come in. And then this is a framework that is well known to Gravity folks because we centered it in our work last spring. And so what our SMEs are doing right now is leading us through analyzing the Prevention Institute framework, the vital conditions framework that was leveraged in the federal plan for equitable long-term recovery and resilience. And then also we're working and pulling in CDC concepts. So that's what we'll bring back when we see you in 2 weeks. Next slide. Okay, so concepts. We have those 3 base metrics from this national consensus work that predates us. And we're going deep into goal statements, right? To support the evidence of strengths-based perspectives in community interventions. More to come on that. And I'm now going to pass the mic to my colleague, an amazing Asha Manuel, to talk us through instruments. Go, Asha, and then I'll come back for other data sources. Go, Asha.
Cool beans. Thank you, Sarah, and good afternoon, everyone. I'm going to walk us through our neighborhood safety instruments that we've identified so far. And I'm just going to do a high-level overview because we have reviewed these at our last meeting, and so I'm just going to speak to them at a very high level. But the first instrument comes from the National Institute for Justice, Measures of Community Perceptions. And the reason why this tool is and this screening instrument is so important is because most of historically the community perceptions of public safety have come from communities that are affluent, educated, and mostly white. And so this tool really helps to understand the underrepresented perspectives of communities of color that are residing in high poverty areas. And so this NIJ initiated the Innovations in Measuring Community Perceptions Challenge, and you can see the constructs that are listed there. And from those, we have 3 items that came from that tool. One about measuring perceptions of safety, and then 2 items that really address trust in law enforcement. Is our community policing being done with dignity and respect from the community's perspective? And this really helps to move us more towards centering community voice in defining safety. So this is why we really like those questions there for that. And we will have more tools to share at a later date, but this is all we have for right now. Are there any questions about that?
I just want to pull in, this is not a question, it's much more of a comment, Lucy, hearing what you said regarding community-based policing. There is a whole lot about community-based policing perspectives and literature in the NIJ approach and model. So if you follow the instrument link, it talks all about community policing. We don't have those questions pulled in yet because our SMEs haven't kind of vetted them to release them. I do want to note we have an old friend back with us to help us with the neighborhood safety domain, Kwesi. And so it's going to be good to work through that all with the subject matter experts. But community-based policing, if you follow the link, hi Kwesi. Community-based policing is 100% all throughout the NIJ approach, and it's the final question that you can see in the methodology there. Any other questions? Okay, we're going to keep going and more to come on all those concepts. Okay, now we're going to go to food access. Neighborhood safety was the first domain. Kwesi's on the call, so I'm doing transitions because he always reminds me I need to do that. Kwesi, right? I'm trying.
Smooth it out. Smooth it out.
Smooth it out. I know. I know. And now we're transitioning into our second of 3 community level domains, food access. Next slide. We have done a whole host of work in food access since we last came. There's going to be a bunch of new concepts, pretty steady state with instruments for a little bit as we leaned into developing concepts. We again thought this was important to say. We're really leaning into how to describe quality, healthy, and low fat. The good thing about that is, and we sent this ahead of time, is those individuals who were involved in the Coding for Food work over the fall of 2024 and the spring of 2025 knows how deeply we we leverage the U.S. dietary guidelines as a base, like evidence-based U.S. appropriate method for defining quality, healthy food and low fat. So our SMEs are exploring leveraging that as well as a consistent reference across all of our work. And we did send it again in advance. And of course, we're thinking about cultural appropriateness and food sovereignty. I saw Cheyenne on the call. Hi, Cheyenne. Next slide. So hi. So we thought it was important as scientists, we do try to ground ourselves in the literature. So we thought it important to, just like we had the framework from the Prevention Institute, which is a framework for analysis and of reference for our concepts. It's important to bring forward frameworks that help us figure out food access and all of our other domains as well. The base orientation to the dimensions of food access comes from a paper by Usher in 2015 called Valuing All Knowledge Through an Expanded Definition of Access. And these are the dimensions we're working through with our subject matter experts. You might not see these words in the concepts, but similarly, how we're working with the frameworks and the Prevention Institute framework and vital conditions, we're using these to assess completeness. Right, we've done this in each of our domains, right? So we have these general concepts. We have these general dimensions? Do we have concepts across each of these dimensions? Are these dimensions thoroughly represented? And so that is the way we're approaching. It's very similar to how we did housing insecurity, food insecurity, right? Those dimensions that matter and trying to get concepts that align. It's a gorgeous article. Sarah put it in the chat, and we encourage you all to read it. Next slide. Oh, and sorry, just one step back, my apologies. I am a little sleep deprived today and travel deprived. Just to name the dimensions: acceptability, accessibility, accommodation, affordability, and availability. And you can see examples below, right? Of those dimensions. You can imagine how they play out in concepts, and you'll see that on the next slide. Next slide. So having the Usher framework, we are then now working through concepts, right? Unique to this domain. Even we had goals for organizations in our racism domain. We had organizational health literacy assessments in health literacy. So we have talked about different measured entities over the course of our 6 years running. We absolutely are going to have to be doing that as well here, right? Because there's community level measured entities, and then there's person level. Like I feel I live in a community with low access to produce. Is different than the USDA census tract assessment, low access to food markets and census tract, right? So across our food access concepts, across our neighborhood green space concepts, across neighborhood safety, you're going to see us defining what is being measured. Again, this goes back to ways and methods we've done this in the past. So these are all concepts that are emerging so far: low access to food markets and census tract, low access to produce. And you can see in community, it's kind of, we don't quite know how we're going to phrase that yet. The in communities in italics is a placeholder. Low access to sufficient variety to eat a balanced diet, access only to poor quality and or unhealthy foods. And some of these quality things are very much in process because they're very interconnected. This is meant to represent the food swap concept, which is very extensive in the literature and definitely connected to structural inequities. There's inconsistent food availability, which is about sustainability over time, right? Very critical for rural communities. Again, thanks our friend Cheyenne, because whenever the truck comes, the truck might not come back for a little bit. So you might have fresh vegetables on a Monday, but they're gone on a Friday, right? And so that stability is really critical as well. Within accessibility, we have disability-focused accessibility concepts, and then we have concepts that are leveraged, focusing on access to USDA food support programs. I want to note there was a great new Center for American Progress paper that came out about how SNAP utilization in rural markets is a sustainability factor because it helps small rural food markets survive. So it's like these concepts are definitely interconnected. That paper we'll try to send around to you all and put it in our literature as well. And then we have acceptability. So, and this is actually, you see this a lot in the instruments we've already approved, right? Because this is a really critical access concept as well. Low access to food that is familiar, low access to food that is culturally appropriate, low access to food that's free of damage and spoilage. Again, this relates to some of that trucking and transportation concept. And then we're exploring nutrition regimen support, right? If you live in an environment where you cannot get celiac friendly food to save your life, right? You have a food access problem, right? And so these are just emerging concepts. There's more to come. And again, you can see how they're connected to the Usher model, and they're really, and we're thinking about the measured entity, and we're just going down the list and trying to ensure that we have all the concepts represented. This is very similar, again, to how we did food insecurity or housing or other or transportation insecurity, for example. Any quick questions? More to come here. Okay, next slide. Now we're on to instruments. Asha, I got it.
All right. Yes, I've got it. I've got it. Okay, so for food access, we have about 4 instruments. And again, these are instruments that we went over last time, so I'm just going to do a very quick overview of them. The first one is MEPS, which is the Medical Expenditure Survey. It comes from the social and health experiences. This one is a perception level of, do you have places in your neighborhood to buy healthy food? Very, very good, solid question. It's perceived availability of healthy options in your neighborhood. Moving on to the next screener, it comes from the neighborhood scale, availability of healthy foods. This captures perceived availability and acceptability in the local food environment related specifically to fresh fruits and vegetables. Again, another solid screening question. Moving on, we have the Fruit and Vegetable Community Assessment Tool that comes from CalAIM, which is part of the California system. And this instrument is designed to capture multiple dimensions of access to fruits and vegetables, specifically, not just whether the food is present, but whether it's accessible, affordable, and acceptable. So it really cuts across a lot of the domains that we're looking at here. Moving on, this is some more of the fruits and vegetable community assessment tool, this time assessing community garden and food bank access within a community. And then the last slide for the fruit and vegetable community assessment tool asks about restaurant options. Are there fruits and vegetable options in the restaurants that that are in your neighborhood? And this really gets to that food swamp concept that Sarah just said, because some neighborhoods have a lot of restaurants in their neighborhood, but not a lot of fresh fruits and vegetables. And then moving on to the NEMS-P. This one is a very good instrument. NEMS stands for, the NEMS-P stands for Perceived Nutrition Environment Measure Survey, and it's designed to capture where people are actually buying their food and how accessible those options are. Actually, that is it. Those are the screening tools that we have for food access identified so far. Are there any questions about that, or is there anything you want to add, Sarah? Before we move on to data sources.
Oh, so Lucy's asking, slide 33, what about access to neighborhood orgs providing meals? So Lucy, we took out the food insecurity, food access slide that we usually preface, and sometimes I'm like, we probably should leave it in. Right. So classically, charitable food systems are not part of ideal concepts of community food access, because ideally people are able to afford and purchase food in markets, right? There are some questions. You can see the CalAIM question does have a food bank question as well, but free food given away was very deeply within our food insecurity work. We talked about it a ton. But right now, for the scopes of aligning with like the principles of community food access, we're really trying to say, like, in the absence of charitable giving, does the community have what you need, right? That is the basic principle. To be determined. Yes. All right. Okay. Now we're on to data sources. There are some emerging data sources probably coming next time, but for right now we have the next slide. The one data element, not instrument, the one data element or data source
Mhm.
we have so far is the Food Access Research Atlas, which has a low access definition, which is low access is defined as being far from a supermarket, supercenter, or large grocery store, right? And this is a USDA map curated by the amazing, brilliant Elena Rowan, who we got to meet. What a pleasure. There are other variables in the USDA Food Access Research Atlas that of intersections of low income, transportation insecurity, and food access. Those, because transportation and access are so critically intertwined, they might be coming back. The SMEs are reviewing those now. This one's static. This has been steady since the first meeting. So it's evergreen. Next slide. Any questions on food access? Okay, then we have exciting updates in access to green space. Next slide. This slide has not changed. Again, you can see very akin to Usher, right? We have concepts in access to green space that we are dimensions that we're building. Bye, Jill. It was lovely having you. Thanks so much. You can tell it's informal. Hope to see you again soon. And so we have availability, accessibility, acceptability, and utilization and safety. These are things we're pulling through. We've talked about this consistently, but of course, neighborhood safety and access to green space are interconnected. You saw on the framework safe access to or safe green space was one of the framework principles. So there's a little Venn diagram here that we note. And we just want to note too that we are, and we're going to say this again, thinking from urban perspectives and non-urban perspectives, rural, me, right? And so we're trying to do the best job we can to ensure that we have not just urban concepts. Next slide. So this is quite fascinating from a measurement perspective. I just want to make sure I'm not missing something. Oh yeah, so Lucy, I hear you. And the question is whether that's this is not, it might feel like a narrowing, but we can explore because certainly the concept of charitable food sources driven by affordability was deeply represented in our food access domain. We can go back and see food insecurity domain. And so all domains are worth, just like we're revisiting our principles, all domains are worth revisiting to make sure they're thorough as part of our enhancements work, you know. But I do want to note that was it's not a narrowing as much as it is a focus on a different facet of food systems adequateness, if that makes sense. Okay. And if Lucy,
I didn't mean that gravity was narrowing. I meant that policy is narrowing access to being able to buy.
Got it.
And okay,
got
it right away. Thank you.
Yes. Well, and Lucy, that relates to the Center for American Progress paper I mentioned, right? So I was talking about, it was a study on New Mexico that noted it was 21%, I think, was the number. No, maybe that's just this number. Anyway, it was a large, the next slide has a 21%. And so the numbers are all getting lost, but it did a risk analysis of the food retailers in New Mexico that will likely go out of business when the SNAP restrictions come into effect. And it was significant, right?
Exactly.
Yes, 100%. So that's why I brought it up earlier, because these dimensions are definitely interconnected. Okay, so we saw the USDA had a very formal definition for low access. With the green space, there's not the same base, this is low concept. So in our current review of literature, there's no clear percent access that is a risk of concern, the same way that we have with USDA. The only time we have found one so far is within our percent of access to green space and recreation facilities that are significant in moving towards child well-being. So we had to figure out a way to take all of the data sources we have and differentiate a threshold. Like, when does a community lean in? When does a community say they might not have to address this one and they can do something else? Thinking again about community health needs assessments. You get lots and lots of data in a CHNA. Where do you put your efforts, right? So at this time, driven by the expertise of our SMEs, we are, and thank you so much, Ryan, out there, right, for giving us the original idea. We're settling on above and below the mean as a threshold for risk. If we can find, or if in emerging literature, there is an N, right? So it's like this percent in a community aligns with the World Health Organization goals for urban park access. This percent does not. So until that time, we're doing above and below. And you'll see this on the next slide. Next slide. So you can see this is what, so in the ParkServe data, right? We have already accepted ParkServe as a data source. It tells you what your percent of green space is according to the ParkServe methodology, which is access defined as being within a 10-minute walk to a qualifying park. 57% is the national average. And so in order to have some kind of threshold, and it kind of is similar to like housing cost burden, where there's a threshold that's established that is housing cost burden. And there is no clear threshold yet for the access to green space. So we're just defining community with above the national average for park access or below, right? And for right now, that's a way we can define that you're at risk as a community or not at risk. The difference is what I mentioned in the second row is in this amazing, gorgeous paper shared to us by our friend, Dr. Neil Ranford. You have a very clear, it's statistically significant if you have 21 to 40% of residential land use allocated to green space to promote child well-being. So in this instance, it was entirely justified for us to say, if you're below 21%, you are at risk, right? We haven't done different gradations like between 21 and 40%, but certainly we were clear in saying, like, it's either, and we should do the I don't think I did the less, I should have done the less here, but you're adequate if you're above 21 and you're inadequate if you're below it, right? Interestingly, this study, the effect diminished if it was over 40, right? So that 21 to 40% is like the sweet spot where you see the most significant change in child well-being outcomes, right? So you have these two different methods. One is above and below the average, and that's in the absence of a clear threshold. And then one is, this one matters. We know it from the literature, 21%. Does that make sense? Roughly? Okay. Chat? Okay, we're doing good. Okay. Next slide. Now, again, I got it down, Asha. Take it away, instruments.
Yes, there we are. Okay. Access to green space. We have two screening tools that we're pulling from for this domain so far. And one, again, Old Faithful, MEPS, the Medical Expenditure Panel Survey, Social and Health Experiences. This is a perception-based measure of how residents experience access to play and recreation spaces nearby. Then the second instrument comes from the People and Nature Survey for England. And question 5 is really rich for capturing not only the perceptions of access, but all the dimensions of quality and usability and the social value of green space. So these are two really solid tools that we are going to use that the SMEs have identified for access to green space. And then now we will talk about the data sources. for access to green space.
Asha. And just gonna note again, I try to say it every time, the nature survey from the UK was found to try to represent rural perspectives, right? So we're trying to not just think about parks, and try to think about nature more inclusively. And also not just green spaces, blue spaces.
Wild spaces.
Wild spaces, blue spaces. We actually, you saw us talk about Park Serve when we taught our concepts, right? So the concepts are definitions or risks, if you, our diagnoses or risk statements, as you can imagine, have to come from a source, right? Because we have to be evidence-based. So long ago, we approved this data source, which is the Trust for Public Land Park Serve methodology. And this is a urban cities and towns data source with, and I already mentioned the definition, access is being defined within 10-minute walk. And this is the one where if you look at the national average, it's 57%. So this is how we calculated the concepts there. Next slide. And then this is, again, just a lovely visual of Park Serve. Next slide. And then we presented this one as well in the past. So this is the CDC National Environmental Public Health Data Tracking Network. And again, this is when I mentioned the CDC National Environmental Public Health Tracking Network does not have a threshold. Like, so USDA on all of their maps and, GIS generated gorgeousness, they have like the low access mark, and you get it in a census tract or not. And then the CDC just has a percentage range, right? So that's where we created, we had to look to Park Serve and the percents there. Next slide. And here we go, the National Environmental Public Health Tracking Network with Vermont and Georgia. Next slide. Any questions? Okay, so we addressed neighborhood safety. We had our Prevention Institute guest talking about the gorgeous framework. And then we talked about how our SMEs are guiding us to have a couple metrics of risk and a lot of concepts of goals and protective factors, right? And we're going to leverage the framework and vital conditions to get there. We talked about food access, and we have a bunch of new concepts that are issuing from Usher's paper. We talked about access to green space and the thresholds there and how they're helping us get diagnoses. I see walking. It's a walking distance. Or we talked about access as wheelchair access as well. And walking is a pretty common threshold. The World Health Organization adequate statement is a walking statement as well. And it's calculated as a walking distance, but I imagine you can get there from any different means. It's just the basis of measurement. Any other questions? All right, so I'm going to quickly just revisit one more time the updates, the cross-domain updates, fun times. So we don't just make diagnoses, sometimes we make documents. Next slide. So we talked about this last time, but we, in our implementation guide, the technical work stream, we did a lot of work last year to align with the most current version of the instantiation of United States Core Data for Interoperability, which is called US Core. This is the data that is entities should support, like platforms should support. And US Core is the framework for that in FHIR. And we wanted to be excluded from a requirement because there weren't enough social care document types in LOINC, and we were not excluded. We were told, go make them because you make concepts. You've got this, right? So we had a year-long push to figure out consensus definitions and concepts to build those LOINC codes for documents. Next slide. And as always, it's always like, how is this not in there before? So we defined the concept of social care and built a social care note. Because anytime you build a note in LOINC, it has to have defined semantic chunks. Like social care note is built of a definition for social care plus note. So to build social care note, we had to build social care definition and then attach it to note, right? So same thing with community health worker note, right? So these are our two first steps into addressing gaps. So we had to define community health worker and its semantic bit, and then you add it to note. So then you get community health worker note, and you get your code 108253-6. So that means these can be sent and exchanged in interoperable ways and tagged for reference and understanding, right? Community health worker notes are everything in social care. And so the fact that this is in there in the ecosystem is huge. And then if you don't have, right now we have this high social care note, but there's more to come. Next slide. This was just to start our attempt to be in compliance, or an attempt to fill our most highest identified gaps. We do note that there might be settings absent, but more importantly, and I say more importantly, because setting can be captured elsewhere, as our dear friend Rob McClure helped us remember 2 weeks ago. Settings are captured elsewhere in the model. They don't have to necessarily be in the LOIN code, but types of services, missing social care types of services, and missing social care types of documents are something we just want to keep on socializing in the community to address any gaps. So if you are reviewing the LOINC document ontology and you feel there's a missing type of document or a missing type of service, we would love to facilitate. Just let us know, and we can work to in our consensus process to fill that gap. Next slide. Woo woo! We did it. We ended early. It's amazing. I know. We don't often do that. Let me see if we have any comments. Thanks, Jonathan. Next slide. Okay, join us always. Next slide. Terminology. Oh, sorry. If we go back, is this the first one? Yes.
The
Okay.
first one.
Yeah. So we talked about a lot of resources. We try to send those. So Sarah Bahal does an amazing job curating resources to send in advance of the meeting. So if you are not part of the Gravity Terminology listserv, you can find it on the Confluence, and you get all the emails, right? All the emails about notifications of meetings and the amazing emails Sarah Bahal curates with resources. So read the resources. There's also things on the Confluence. If you feel like there's a missing concept, submit it to gravityproject.hl7.org. You can read stuff on the Food Access Confluence page, the Neighborhood Safety Confluence page, and the Access to Green Place Confluence page. I'm so glad, Joe. It's good to see you again. And next slide. Keep on coming. We'll see you every other week here in the terminology work stream. And then the technical work stream, as we mentioned, is Wednesdays from 1 to 2. Next implementation meeting is in November. And have a lovely Thursday. Bye, friends.
Bye. Thank you, everyone.